Alcohol is the third leading cause of death in the United States, and the numbers continue to rise. The Partnership for a Healthier New York City is working to address these problems through delivery of public education campaigns, and we are pleased to be joined by the Alcohol Program Manager for the Partnership for a Healthier New York City, Laena Orkin, and the Coordinator of Community Programs for the Archdiocese of New York Drug Abuse Prevention Program, Ms. Janet Bliss. That's a whole lot to say, but I was able to say it anyway. Thank you very much for both of you joining us. And obviously, as we said, you're coming out. This is May the 1st, but April was a very busy month for both of you.
Yes, April was Alcohol Awareness Month, and so a lot was happening around the city as part of the partnership and other efforts that were happening. We had a huge event on April 10th where we used art and film to showcase the hidden harms of alcohol. It was great. We had dozens of organizations. Janet's organization was part of it as well, and we're doing lots. We also have a great infographic about the hidden harms of alcohol that we've been promoting. Lots going on, and just because it's May 1st doesn't mean our work is over.
That's
we have to continue to raise awareness.
Well, can you give us a little bit about those hidden harms of alcohol? Because I think sometimes what we see is just, people just use and think, hey, it's okay, but there are some harms.
Definitely. Well, we could talk about either the underage drinkers or the seniors, which is the area that we're moving into. Mm-hmm. I kind of see that more as the hidden population with
seniors,
the hidden seniors, the hidden population, because as seniors are reaching 60 and 65. No one seems to want to address their use of alcohol mixed with medication. The medical profession, themselves, families, everyone. It's kind of like the adolescents. It's almost like a rite of passage. They lived all these years. Oh, let them have fun. They grew up in the generation where they saw Dean Martin, Sammy Davis Jr., that whole Rat Pack, drinking and having a great time on TV, thinking that that's the norm. But now we're finding out, and much more research is coming out to show that that's not the norm, and there are risks involved. And just recently, talk about Alcohol Awareness Month, April 29th, the New York Times put out an article about the rising tide of substance abuse, focusing on the elderly. Very interesting statistics. They're saying the sense of magnitude of the looming mental health crisis for the year 2010, with 14 to 20% of the elderly have had either a substance abuse crisis or a mental health issue. And as the baby boomers are living longer, they're coming into that stage of life with even more a larger history of substance abuse as well.
And we're seeing the graphic on the screen talking about adult binge drinking by income and gender. We just saw that graphic right there, and you're looking and you're seeing a lot of seniors becoming more involved. We're also seeing a lot of underage drinking that's becoming involved in too. Give a little bit about your efforts to really curb and bring awareness to underage drinking.
Sure. So we definitely care at the partnership about underage drinking for many reasons. First of all, there's been a lot of research showing that the earlier people start drinking, the more likely they are to have problems down the line. There's actually some really scary research showing that alcohol use, especially in the underage crowd, is actually a major risk factor in the 3 leading causes of death for that population. So accidental injuries, homicide, and suicide, which is very concerning. And so we're really concerned about that. In the Bronx, and actually citywide, about 1 in 3 youth report ever drinking, which is really concerning because there are all sorts of other unintended consequences too. For instance, clearly when you're drinking, you might be more likely to not use a condom, which can lead to STDs and unplanned pregnancies, which is a huge issue, in the city and especially in the Bronx. We also have the issue of violence, which is definitely associated with alcohol, and those issues span the whole lifeline. It doesn't matter how old you are. Alcohol really can be associated with many things that we're concerned about. Also cancer. There's been some new research coming out, talk about relevancy to the elderly population as well. Some research around cancer and alcohol, which hasn't really been talked about very much. So really that's why we want to raise awareness. We've been trying to be more creative by using art and film, like for our event on April 10th. We actually just worked with the Educational and Video Center to create a film called Under 21 that's been screened around the Bronx as well as around the city. So we're really just trying to be creative and really think outside the box, because I think there are a lot of issues like HIV and violence that people really care about, but they might not be talking to the alcohol people. And so maybe we can bring them together to talk about the issue.
I think one of the notes that I had here that really stuck out to me was 2 in 5 youth, 40% of youth who begin drinking before the age of 15 will become alcohol dependent in their lifetime. That's major.
Absolutely. It's really worrisome, and actually it's extremely relevant to news that just came out, I believe, earlier this spring. The State Liquor Authority did undercover operations in neighborhoods across the city, and they found that 60% of the retailers that were approached as part of this investigation in the Bronx sold to someone who was underage. So we really need to think about, as retailers, as parents, as friends, how can we limit the promotion and accessibility of alcohol to our youth, because it is so harmful for them to start drinking at such a young age for many reasons.
Yeah, I'd just like to add to that. In Throgs Neck, we did a survey among high school youth and parents, and the one factor that came out, and that was very consistent among both, is that the lack of awareness of the harmful effects, and youth's access to alcohol is mainly from their own home or their friend's home. So there is this looming perception that it's a rite of passage.
So you can go to your friend's house pretty much, and most people, they say, well, you know, I didn't start at home, I started at my friend's house. But these are places where people really should be paying very close attention.
The home.
If, you know, the home. So when people go visit, you got to be very careful where your children go visit.
Yeah, it's definitely, it's really concerning, and so I think that as much as we can be more aware about those harms that, you know, that people don't always think about. I think most people at this point are aware of the harm to your liver, alcoholism, drunk driving, but we're really trying to raise awareness about those other harms that I mentioned earlier, like the STDs, the unplanned pregnancies, violence, even domestic violence. There has been, you know, oftentimes alcohol is involved in some way in sexual assaults and domestic violence. And actually, April was also Sexual Assault Awareness Month, so we tried to do some work with folks from that arena as well, which I think is really our goal at the partnership, and with folks like Janet, is trying to work with traditional stakeholders, people who've done work in the substance abuse arena before, but also bring in other folks who actually care about issues that are absolutely related to alcohol as well. They just might not realize it.
Let me ask you the question about public reception, because here in New York City, you know, a lot of people are just, you know, caught up with the whole fact of the mayor and him trying to deal with, you know, what you can eat and what you can drink, and, you know, the whole healthier lifestyle that he's trying to promote. And you got New Yorkers say, look, mind your business. I really don't want you to be involved in my business. I'll deal. What kind of public reception are you guys getting, particularly when you talk about alcohol? Because, you know, you do have that factor of people, the faction of people say, you know what, it's my business, I'm going to do what I want to do. What kind of reception are you getting when you bring out and break out these statistics and let people know about the harmful effects?
We've gotten actually a lot of positive reception. We actually did a project called Share Your Story, which is actually continuing, where we got postcards and we asked people to share their story about how alcohol affected them, someone they love, or their community. And I think at first people look at the postcard and they're sitting there and they're thinking, and then all of a sudden they write this amazing story. And we've been collecting the stories, and myself and my colleagues have been reviewing them and have been, you know, really surprised by this, what people have shared. And I think once you start to think about how alcohol is part of your life, or, you know, others around you, you come up with a lot of stories. And so that's where we start with the personal story, the connection. Then all the statistic, as you had shared earlier, the third leading preventable cause of death in this country. People start to listen, and they start to realize that this is relevant to my life, and that I should care.
I was just going to add, also, I think one of the other important things is helping parents realize that what they say does matter.
And what they do matters.
And what they do matters. And that's one of the key things that
raising. So mainly you're telling, if you're telling your kid don't drink, you shouldn't be drinking in front of your kid.
Exactly.
Okay,
and especially getting in the car. So, I mean, that's one of the key things is really raising awareness. And when parents feel like, I did it when I grew up, my child is going to be fine, it's illegal.
Right.
You can take that risk, but just know it's illegal.
And kids are drinking different than they used to. There's actually some research showing that, you know, a couple decades ago, kids were drinking mostly beer. That was their drink of choice. Now they're drinking liquor. Liquor has a much higher alcohol content than beer, and so it's a lot easier to get yourself in a really scary situation if you're drinking liquor. And so I think a lot of parents might not realize that it's a different environment these days. Kids are drinking different types of alcohol, which can lead to a lot more harms to them and to those around them.
And what we've noticed with social media, that's where kids start seeing themselves on Facebook or Twitter or something, and then they're embarrassed, and that's where they start realizing, oh gee, did I do that? I don't want to see myself behaving that way. So that's another way that they themselves are somehow using social media as kind of mirroring their own behavior.
And sounding the trumpet for all of this, and it definitely a notable cause and a most noteworthy cause. Question is about success rate. How do you monitor what kind of success rate you're having amongst young people and amongst the things that you're doing? Because, you know, in this right now, we can admit it's an uphill battle. Is there any way to, you know, get some gas in your tank to say, hey, we're having some success with this?
Sure. Well, you know, the Department of Health for the City of New York does measure regularly different pieces of data, like how often, how much youth drink, how often they're drinking, same with adults, what are they drinking. So there's a lot of data that's being collected on the citywide level, which, you know, there's a lot that's happening in the city beyond what we're doing. And so that is something that you could look at to see what's going on. But I think that we've, at least at the partnership, been trying to collect more data of how, you know, how people perceive the video that we're showing, how people perceive how the event that happened a couple weeks ago, how that went. And we're really seeing that folks are starting to change their attitudes a little bit, and I think it's been really promising.
And for us, we've seen, as I said, we have done some surveys in our community, and we are beginning to see some change in attitudes. So that's a key. And one of the things, if I could just add a plug in, one of the things we have done, this is for the youth in our community, addressing the parents, letting them know the risk is real. These are bottle tags that high school students have been going around putting at stores, and so when parents go, adults go and purchase it, it reminds them. Teach your teen to think, not drink.
Beautiful. So now, before we leave, and I gotta get you, before I let you guys go, there might be a community-based organization, a parent, or somebody out there that's watching right now, saying, "Listen, you know, I don't really," and because admittedly, there's some parents who don't know how to craft that message and to bring that message home, where there might be somebody that's not just really familiar with talking about that, so they can bring you in. How do they go about bringing you in, and what kind of things do you offer to people to kind of like to get the dialogue going? Sure.
So the Partnership for a Healthier New York City is a citywide organization, but we do have a coalition in the Bronx that's doing work around alcohol, and actually Janet is part of that coalition. And the next coalition meeting is on May 16th from 2 to 4 p.m. at the Walton Family Health Center. So I would encourage people, whether you're a community organization or just a community member who cares, to come, listen, and learn. We would love to have you be part of the conversation and be part of the solution. Also, healthiernyc.org has some great resources on the website, whether it's fact sheets or connections to our social media.
All right. Well, thank you both for coming and sharing.
Thank you.
About out of time for this segment, but